In the newsroom article, it says this, because one of the questions, of course, we think of is, the back office and the front line. The back office, front line, which we've been told about for 18 months now. While thousands of public sector jobs are being cut as part of government savings drive, Health Minister Dr Reti says Te Whatu Ora isn't subject to that directive. So this is the other thing. Dr Reti is telling the country, that there's not going to be any staffing cuts at all. So if there's not going to be staffing cuts, where the hell are they finding $13.3 million from to save, when we already know that the public health system seems, some parts of the world it's not doing too bad, but it is actually underfunded already. So what are they going to do to save these $13.3 million in 2.5 months if they're not going to just get rid of a bunch of staff?
That's the question. Now, one of the projects I've been working on for some time now is going back and looking at the Crown Health Enterprise accounts for Canterbury from 1993 right through to 2000, and then the CDHB from 2000 to 2022. And so I've compiled a pretty massive spreadsheet. I was originally asked by some senior clinicians, could I please explain why DHBs were running financial deficits? And they said, look, could you write a paper for about, say, 5,500 words? My research to date is up to 80,000 words and still going, partly because I couldn't get the full set of 2022 accounts out of the DHBs until this year. It took a lot of letters and emails, rather, to the minister to say, where are these accounts? I finally have them. And secondly, Health New Zealand's own accounts, which were due 30th of June 2023, they were not released till the 5th of December last year. So I now have those figures. And we find yet more problems. The 2023 accounts for Health New Zealand have no comparative figures. So in other words, they haven't consolidated the former 20 DHBs for 2022, as you would normally do, pardon me, in an accounting exercise, and you put those comparative figures alongside your actuals for this financial year. So we actually have no idea how well Health New Zealand has done relative to the 20 DHBs in the previous financial year. But what we can say is two things. One, Health New Zealand ran a deficit last year, 2023, of over $1 billion, that's B for billion dollars, and the indications are that Health New Zealand is set to run yet another massive deficit this financial year, 30th of June 2024. But of course, we won't have those numbers, probably, I would say, until December this year. So, in spite of Dr Reti saying, we're going to make savings and all the rest of it, we are basically doing the same thing we've done since 1993. We are progressively running deficits right across our public health system. Why? Because it is fundamentally underfunded. And we have a continuation of that. And now they're trying to stave 13.3 million.
Kia ora again, whānau. The clip you've just watched is brought to you today by our patrons. If you want to be a part of what we do, if you want to get behind what we're doing, if you're enjoying our content and wanting to share our content, then maybe you would consider being a patron to Big Hairy News. Head to www.patreon.com/Big Hairy News to sign up to one of our levels and be a patron. At this point, we are only a listener and viewer supported show. It all comes down to you guys. If you feel like jumping on board to help, then head to patreon.com/Big Hairy News. Hooroo!